Hello, everybody, and thank you for joining us today. This is our very first Healthy Siouxland podcast. My name is Ana Izadame. I'm a health promotion specialist here with Siouxland District Health Department. And today we have RN Lori Otkin, who is going to be talking to us about sexually transmitted infections or STIs. Feel free to leave a comment or question in the chat, and we will get to it as they come in. Lori, do you want to introduce yourself?
Sure. Good afternoon, everybody. I'm Lori Otkin, and I'm one of the public health nurse clinicians here at the health department. I've been a public health nurse for about 20 years, and then I'm just one of three STI clinicians that we have here at the lab.
And can you tell us more about the services that the health department offers in regards to sexually transmitted infections?
Sure. Our services are very private and very confidential. We do take appointments, and we also are able to provide male exams as well. We do have staff in the laboratory that do provide the male exams, and then our nurse clinicians, they do the female exams for appointments.
So I know you said that we do take appointments, but can someone just walk in, or are appointments absolutely required?
We do have folks that do walk in and are quite concerned, and we try to work those into the schedule and accommodate them and get some information and accommodate them while they're here in the building. But we do encourage folks to give us a call and schedule an appointment so we can give you some dedicated time. It does take about 45 minutes to an hour for a female exam. It's a little bit shorter for a male exam. So we like to really give you some good quality time, get a good sexual health history, a good physical, and do the exam. And we need extra time, and a lot of extra time is needed for educating that individual.
And how confidential are these services?
We keep all the information here at the health department. We don't need a parent to bring in anyone that's under 18. And if you do come in with a parent or a significant other, we ask them to wait out in the chairs because we want to provide you with the best information and exam and keep everything confidential. So yes, we do see a lot of people under 18, and you don't need to have a parent to bring you in.
What about insurance? Does someone need insurance, or is insurance billed when requesting these services?
Nope, our services are free. We do ask the question if you have private insurance or Medicaid, but we do not bill insurances. We don't bill private insurance, so our services are free.
Okay. And can you tell us about the symptoms when someone has an STI?
A lot of times individual females may not know that they have an STI. They may not have any symptoms. Sometimes they may have some abdominal pain, maybe some discharge, or we hear a lot of times that something just feels a little bit off. Males may have some discharge or some discomfort when urinating. We do have some individuals that will call us and they believe that they've been a contact to someone with an STI and need to get in for an exam.
And who is at risk for getting an STI?
Obviously, anyone having sex, and those individuals with maybe multiple partners, individuals that have histories of STIs. We know statistics show us that individuals 16 to 24 years of life are at highest risk for an STI, but doesn't necessarily mean someone at 30 years old is not at risk. When you're having sex with multiple partners or individuals you may not know or have met on social media, puts you more at risk. Men having sex with men is a higher risk population. IV drug use, those who are using drugs and alcohol, puts them more at risk for an STI.
And how does someone go about preventing an STI?
Obviously, abstinence is the number one way to prevent an STI, but using condoms each and every time that you have sex and using it correctly, using dental dams when you're having oral sex, but using those condoms each time that you have anal sex, vaginal sex, or oral sex will help prevent STIs. And like I said, avoiding alcohol and drugs, limiting your partners, and knowing who you're having sex with. Those individuals that maybe you have met on social media, Facebook, or met through other acquaintances, make sure that you know who your partners are.
Where can someone get condoms?
You can come anytime to the health department. We have them here. We also have a website, My Iowa Condoms, that you can log into, and it just shows you different areas in the community or in your county that you can get free condoms. Siouxland Community Health Center across the street from us is another asset for us in our community.
Is there any additional information you would like to provide or that you would think it's important for people to know?
I think just paying attention to your body and watching for signs or symptoms, kind of avoiding those risky situations. Education is the biggest thing, especially with young population, that we're educating them on STI prevention and just safety overall as far as females and males being safe, and who they're having sex with. Like I said, avoiding the drugs and alcohol use when you're having sex, limiting, the number of partners.
And if someone has a question, who do they call or who do they try to get in contact with?
Yep, they can call us here at the health department at 279-6119. We do have a scheduler that will schedule appointments. If you just have general questions for us, you can also ask for one of the nurse clinicians or someone in the laboratory. And like I said before, we do female exams and male exams. It's also quite nice if maybe the female partner is having some symptoms or concerns, that she bring her male partner with her, so we can do both the exams at the same time. And then if they need treatment, we can treat them while they're both here. And it's very important that taking the medication, if we give medication to you, and completing the course of treatment.
So it doesn't look like we have any questions in the chat. Thank you, Lori, for providing all of that great information to us. Like Lori mentioned, if you have any questions, you can contact us. Like she said, phone number is 712-279-6119. You can also message us directly if you don't feel comfortable calling us. This podcast will also be available on our YouTube page, as well as our website, siouxlanddistricthealth.org, and on our Facebook page, as well as most podcast stations. Next podcast will be scheduled for March 1st on Facebook Live at noon, and the topic will be disability and inclusion. So we will see you all then. Thank you for joining.